Dear President of the conference, distinguished experts, I would like to greet you all and thank the organizer for their kind invitation. I'm Dr. Chen from the Interventional Department of the Fudan University Affiliated Public Health Clinic Center. Today, I would like to present to you the research progress on the topic of radiomics in taste treatment for liver cancer. According to the latest statistical report from the International Agency for Research on Cancer of the World Health Organization, liver cancer ranks 6th in terms of incidence among all tumors, with approximately 900,000 new cases reported each year. It's also ranked 3rd in terms of mortality, with around 830,000 of deaths annually. The incidence rate is significantly higher in males compared to females. The development of hepatocellular carcinoma is a highly complex process characterized by features such as insidious onset, rapid disease progression, multicentric tumor origin, propensity for vascular invasion, metastasis, and high tumor heterogeneity. These characteristics ultimately result in the majority of HCC patients being unable to receive curative treatment. Currently, there are many recognized treatment options for HCC, including liver transplantation, liver resection, TACE, ablation, immunotherapy, and radiochemotherapy, and so on. Personalized treatment is guided by the patient tumor staging, liver function, ECO score, and other factors when developing treatment plans. However, there are multiple combinations of treatment options available for patients with the same tumor stage. Determining which treatment approach can significantly improve efficacy remains an area that requires further research. Transarterial chemioembolization is a procedure where a catheter is selectively or superselectively inserted from the skin into the target artery, supplying the tumor, and an appropriate amount of embolic agent is injected at the appropriate rate to block the target artery, leading to ischemic necrosis of the tumor tissue. According to the 2022 edition of the China Guideline of Primary Liver Cancer Diagnosis and Treatment, TACE has transitioned from being specifically for intermediate stage liver cancer to encompassing the entire process of HCC development. The treatment approach has also evolved from simple TACE to TACE Plus, which involves combination treatment such as ablation or systematic therapy. Currently, the clinical prognostic factors for HCC include VEGF, pathological grade, presence of microvascular invasion, and pretumoral aggression. However, obtaining this state requires invasive procedures such as biopsy or postoperative pathology, and the conclusion may have some lag time. Traditional imaging techniques are unable to accurately predict the efficacy of TACE, so researchers have developed some clinical prediction models, including the well-known 6 and 12 model, 4 and 7 model, as well as the continuously revised HAP model, ALBI model, and others. As a new technology, can radiomics fill the gaps of traditional imaging examination and demonstrate significant clinical application values in non-invasive and precise prediction of TACE efficacy? Let's take a closer look at radiomics, which was first proposed by Dutch research lobby in 2012. Radiomics involved extracting a large number of features from medical images through high-throughput analysis. It transforms imaging data into high-resolution and exploitable data through automatic or semi-automatic analysis methods, enable comprehensive, non-invasive, and quantitative monitor for tumor heterogeneity. The main aspects of radiomics include imaging segmentation and pre-processing, feature extraction, data preprocessing, data statistical analysis, and clinical application. Image segmentation and pre-processing are mainly performed using software such as MITK, aligning the central position of image Radiomics feature consists of a collection of traditional image features, including first-order gradient feature, shape feature, texture feature, as well as transformed feature using various image filtering techniques such as wavelet transform and square root filtering. This feature can be extracted using passing software. Date preprocessing primarily involved normalization of the date. Data statistical analysis often involved using lasso regression to change the coefficient of less significant feature to zero, achieving feature selection. Linear fitting based on the contribution of feature result in the corresponding linear equation known as RAS score. Nomograms are commonly used for clinical application. Probability of patient outcomes can be calculated based on the regression coefficient, and model evaluation can be performed using ROC curve and calibration curve. Decision curve analysis and clinical impact curves can also be employed to calculate net benefit and find the model with the highest net benefit. Radiomics is considered an excellent quantitative technique that can be used to evaluate tumor treatment efficacy and formulate corresponding treatment strategies while also eliminating observed related error. Next, we will introduce several research examples to demonstrate the outstanding predictive value of radiomics in three aspects: predicting treatment efficacy, choice of treatment modality, and several analyses that first focus on treatment efficacy prediction. In this study, MRI images at three different stages was used to construct a nomogram. A total of 122 cases of HCC was included and divided into good response and poor response groups based on MRECIST criteria. The model was built using lasso regression. A total of 9 sets of models was constructed, including the clinical radiology model, 7 radiomics model, and 1 combined model. Purely from the perspective of radiomics model, the 3-phase MRI combined model contained 2 features from each phase, resulting in a total of 6 features, both in the training and validating groups, this group exhibiting the largest area under the curve, indicating its significantly improved predictive ability compared to single-phase or 2-phase scan prediction models. From the graph, it can be observed that the combined models contain clinical indicators outperformed the 3-phase radiomics model, demonstrating the highest diagnosed accuracy among all models, with an area under the curve reaching 87%. Moreover, the combined models achieved the max sensitivity and specificity in prediction. The calibration curve of the CRC model closely aligned with the diagonal line, demonstrating its excellent predictive performance. The decision curve analysis also suggests that the combined model is significantly superior to purely radiomics or clinical model. Next is aspect about choice of treatment modality. Currently, the evaluation of post-test efficacy is often based on the pre-procedure tumor enhancement degree and the post-procedure iodized oil deposition. However, this evaluation was most empirical judgment. For patients with poor response to TACE, it's generally recommended to undergo combination therapy. Therefore, Professor Kudo of the Japanese Association for the Study of Liver Disease proposed the concept of TACE resistance, which refers to cases where the tumor continues to progress, exhibit vascular invasion, or distant metastasis, or to show sustained evaluation of tumor markers after 2 rounds of TACE. For this patient, can we use radiomics methods to predict the presence of TACE resistance preoperatively. The researchers used the CT images at 4 different phases to construct a predictive model for taste resistance. A total of 18 cases of HCC was included, and they were divided into the taste-resistant groups and the non-taste-resistant groups based on the M-resist category. Multivariate analysis was conducted to build 3 models: T-stage combined with red score, AFP combined with red score, and Bilaba combined with red score to predict taste resistance. ROC analysis indicated that the T-stage combined with red score and AFP combined with red score had the largest area on the curve, reaching 95%. Here are 2 cases. The first case is a 68-year-old male with a 4 cm lesion in the right lobe of the liver. The arterial phase enhancement is not significant, according to our routine experience. Iodized oil deposition may be inadequately in this patient, suggesting poor taste efficacy. However, based on the nomogram score, the probability of taste resistance is low. Subsequent follow-up reveals dense iodized oil deposition, indicated the absence of taste resistance and no tumor progression. The predicted result align perfectly with the actual outcome. This is another case. The arterial phase enhancement is uneven and significantly enhanced. There were no lymph node metastases before treatment. Based on the linear predictive indicator, the probability of taste resistance is high. Subsequent re-examination after taste showed multiple lymph node metastases, which again correspond to the predictive outcome. Finally, let's look at survival analysis. Due to the heterogeneity of hepatocellular carcinoma, the radiomics feature of single liver images do not reflect the whole tumor picture well. Therefore, the authors innovatively delineated the complete 3-dimensional volume of the tumor. A total of 162 cases of HCC was included, mainly BCLC-B, and an on-demand taste treatment strategy was employed. The best radiomics feature was derived from the arterial and portal phases, with 2 features from the tumor periphery and 4 features from the tumor interior. The CRC model outperformed all clinical models. In the training and testing cohort, the C-index was 0.73 and 0.7, respectively. Among 7 clinical prediction models, the 6 and 12 models and the 4 and 7 models showed better performance than other models. However, the time-dependent AUROC values still suggest that the combined model has the best predictive performance. Based on the calibration curve of the CRC model, it also demonstrated good predictive ability for 1-year and 2-year survival probabilities. Once again, by combining the red score and the tumor number, an individualized risk score was generated. The low-risk group median survival is 31.3 months, had significantly longer survival time than the high-risk group. Median survival is 12.5 months. Other authors also reached the same conclusion. Similarly, based on the M-resist criteria, patients were divided into the good response group and the poor response groups. Multivariable logistic regression analysis showed that the test set based on T2WI red score could predict taste treatment response, and the AUC of combined models with ALBI and BCLC was the largest in both training set and validating set. Celebration and decision curve analysis indicated that the combined model had the best predictive ability and decision efficiency. The combined predictive models and the KM curve analysis was used to analyze the survival of both groups of patients. The result shows a high degree of similarity, indicating that the predictive models could well predict the PSF and OS of HCC patient. Based on the analysis example above, we believe that radiomics can predict treatment efficacy, select treatment strategies, and analyze pre-test survival rate. By combining clinical data to construct combined predictive models, the predictive ability of existing models can be significantly improved. If anyone is interested in the above sharing, you can search for this review on Web of Science. Thank you for the invitation from the conference, and I would like to express my gratitude to Professor Mao Chenli and Professor Feng Jing from Shanghai 10th People Hospital Interventional and Vascular Surgery Department. My presentation is over. Thank you.